When you find out you're having twins, the first thing you feel is shock, then excitement, then panic. How do you feed two babies at once? How do you sleep? How is your body even going to carry two babies? I'm a physician assistant who's helped deliver dozens of twins. And today, I'm explaining exactly how twin pregnancy is different from singleton pregnancy and what you actually need to know. Because twins change everything. First, let's talk about the types of twins. Because this isn't just trivia, it affects your entire pregnancy. Fraternal twins, dizygotic. These come from two separate eggs fertilized by two separate sperm. They have two separate placentas and two separate amniotic sacs. We call this dichorionic diamniotic. They can be different genders. They share about 50% of their DNA like regular siblings. This is the most common type. About 70% of twins are fraternal. Identical twins, monozygotic. These come from one egg that's split into two embryos. They share the same DNA. They're always the same gender, but here's where it gets important. How they share the placenta and sac depends on when the egg split. If it's split early, days 1 to 3, they have separate placentas and sacs dichorionic diamniotic, just like fraternal twins. If it's split later, days 4 to 8, they share a placenta but have separate sacs, monochorionic diamniotic. If it's split even later, days 9 to 12, they share both placenta and sac monochorionic monoamniotic. This is rare and high risk. Why this matters? Twins who share a placenta monochorionic have higher risks, specifically twin-to-twin transfusion syndrome, where one baby gets more blood flow than the other. Your doctor will determine chorionicity at your first ultrasound. This dictates how closely you'll be monitored. If you have monochorionic twins, you'll have ultrasounds every 2 weeks to check for TTTS. If you have dichorionic twins, monitoring is less intense but still more frequent than singleton pregnancies. So when someone asks, are they identical? That's not just curiosity, it's medically relevant. Now let's talk about what twin pregnancy actually feels like. Take every singleton pregnancy symptom and multiply it. That's twins. First trimester, it hits hard. Morning sickness, more like all-day sickness. Your HCG levels are almost double with twins. HCG is the hormone that causes nausea. I've had patients who couldn't keep anything down for weeks. Hyperemesis gravidarum is more common with twins. Fatigue? Extreme. You're growing two babies. Your body is working overtime. You'll be exhausted in a way that feels impossible to explain. Some women need to nap twice a day just to function. Second trimester, you get bigger faster. At 20 weeks with twins, you'll look like you're 28 to 30 weeks with a singleton. Your belly grows fast. Your uterus is stretching to accommodate two babies. Round ligament pain. Those sharp pains in your lower abdomen start earlier and feel worse. Heartburn starts earlier too. Two babies means more pressure on your stomach. You might start feeling breathless sooner because your diaphragm gets compressed. Third trimester, survival mode. This is where twin pregnancy gets really hard. By 32 weeks, you feel full term. But twins often stay in until 36 to 38 weeks. You can't breathe. Two babies are pressing on your diaphragm. Sleeping propped up becomes necessary. You can't eat full meals. Your stomach is squished. You'll eat small amounts constantly. You can't move easily. Everything hurts. Your back, your pelvis, your ribs. Swelling is worse. Your body is retaining more fluid to support two placentas. You'll probably pee every hour, day and night. And the weight gain? You'll gain 35 to 45 pounds on average with twins, compared to 25 to 35 with a singleton. That's normal, that's healthy, but it's also exhausting. The symptoms nobody warns you about. Carpal tunnel, hand numbness, is more common with twins because of the extra fluid retention. Symphysis pubis dysfunction, where your pelvic bones feel like they're separating, happens more often because you're carrying more weight. Restless legs at night. The extra weight and pressure make this worse. And the Braxton Hicks contractions? They start earlier and feel stronger. Your uterus is working hard to hold two babies. It's practicing constantly. I need to be honest with you about risks. Twin pregnancies are considered high risk automatically. That doesn't mean something will definitely go wrong. It just means the chances are higher. Preterm labor. This is the biggest risk. About 50% of twins are born before 37 weeks. The average twin delivery is around 35 to 36 weeks. Your body can only stretch so much. 2 babies means more pressure on your cervix. You'll be monitored closely for signs of preterm labor, cervical shortening, contractions, dilation. Some women need bed rest. Some need progesterone shots to prevent early labor. If you make it to 37 weeks with twins, that's considered full term. You did it. Preeclampsia, high blood pressure during pregnancy. Twin moms have about double the risk of preeclampsia compared to singleton moms. Your doctor will check your blood pressure at every appointment and watch for symptoms: headaches, vision changes, swelling, protein in urine. If you develop severe preeclampsia, you might deliver early to keep you safe. Gestational diabetes, also more common with twins. You'll do the glucose tolerance test around 24 to 28 weeks, same as singleton pregnancies. But with twins, some doctors test earlier because the risk is higher. If you have gestational diabetes, you'll need to monitor your blood sugar and adjust your diet. Sometimes you need insulin. Twin-to-twin transfusion syndrome, TTTS. This only happens with monochorionic twins, the ones sharing a placenta. One baby gets too much blood flow, one doesn't get enough. It's serious. It requires immediate treatment, sometimes surgery while you're still pregnant. This is why monochorionic twins get ultrasounds every 2 weeks. Early detection is crucial. Growth restriction. Sometimes one twin grows slower than the other. Your doctor will measure both babies at every ultrasound to make sure they're both growing appropriately. If one baby is significantly smaller, you might deliver early to give that baby better nutrition outside the womb. The bottom line? Yes, there are more risks. But modern medicine is really good at managing twin pregnancies. You'll have more appointments, more ultrasounds, more monitoring. That's not to scare you. That's to keep you and your baby safe. Most twin pregnancies result in 2 healthy babies and a healthy mom. Let's talk about how these babies are actually coming out. Vaginal delivery is possible if twin A, the baby closer to your cervix, is head down. You have no complications. Your doctor is experienced with twin deliveries. About 40 to 50% of twin moms deliver vaginally. Here's what happens. Twin A delivers first, usually normally. Then the doctor delivers twin B, who might be head down or breech. Sometimes twin B flips to breech after twin A is born because there's suddenly more room. Your doctor can sometimes manually turn the baby or deliver breech. There's a small risk that twin A delivers vaginally, but twin B has complications and needs an emergency C-section. This is rare but possible. C-section is more common. About 75% of twins are delivered via C-section. Automatic C-section if twin A is breech, baby closer to cervix is feet first. Babies share an amniotic sac, monoamniotic. You have triplets or more. There are complications like preeclampsia or fetal distress. Scheduled C-section reasons. Your doctor isn't experienced with vaginal twin delivery. You prefer it for peace of mind. You had a previous C-section. Most doctors recommend delivering twins by 38 weeks, even if there are no complications. If you're having a scheduled C-section, it's usually around 37 to 38 weeks. Why? Because the risk of stillbirth increases slightly after 38 weeks with twins. It's safer to deliver a little early. What I tell my patients, don't get too attached to a specific delivery method. You can plan for vaginal delivery, but be mentally prepared for C-section. The goal is 2 healthy babies. How they come out is less important. I've seen women deliver twin A vaginally, then need an emergency C-section for twin B. That's tough, but both babies were healthy. Stay flexible. Trust your doctor. Now, the part nobody adequately prepares you for. Taking care of 2 newborns is exponentially harder than 1. Feeding. This is the biggest challenge. If you're breastfeeding, you can feed 2 babies. Your body will make enough milk. But it's hard. Some women tandem nurse feeding both babies at the same time. This requires special pillows and practice. Some women feed one at a time. This means you're feeding almost constantly. As soon as you finish with one baby, the other is hungry. Some women pump and bottle feed so partners can help. Some women do formula. There's no right answer. You'll figure out what works for your family, but expect feeding to take up most of your day and night for the first few months. Sleep deprivation, it's brutal. With one baby, you sleep when the baby sleeps. With two babies, they're never sleeping at the same time. You'll be up constantly. Some parents do shifts. One takes midnight to 4 a.m., the other takes 4 a.m. to 8 a.m. You need help. From your partner, family, friends, hired help. You can't do this alone. The work is doubled. Two babies means twice the diapers, about 16 to 20 diaper changes per day, twice the laundry, twice the doctor appointments, twice the sleep regressions, twice the crying. You can't soothe one while holding the other. When they both cry at once, you have to prioritize or let one cry while you handle the other. That's heartbreaking, but it's reality. Higher PPD risk. Postpartum depression and anxiety rates are higher in twin moms. The exhaustion is extreme. The overwhelm is real. Watch for symptoms: persistent sadness, anxiety, intrusive thoughts, inability to bond with babies. Get help immediately if you're struggling. This is not weakness, this is biology plus impossible circumstances. You need more help than you think. If someone offers help, say yes. Meal trains, cleaning help, someone to hold a baby while you shower, accept it all. The first 3 months are survival. Lower all your standards. Dishes in the sink? Fine. Laundry piling up? Fine. You haven't showered in 2 days? Fine. You're keeping 2 tiny humans alive. That's enough. Let's talk about the logistics nobody mentions. Financial reality. Daycare costs double. If daycare is $1,500 per month for one baby, it's $3,000 for 2. Formula costs double if you're not breastfeeding. That's $200 to $300 per month. Diapers double, about $150 per month for 2 babies. But, and this is important, gear doesn't necessarily double. You can use the same crib for both at first, same changing table, same high chairs, just not at the same time. Buy one of everything, see what you actually use, then buy a second if needed. Space considerations: 2 car seats. Your car might not fit 2 infant seats plus another child seat. Some families need to upgrade vehicles, 2 cribs eventually. Babies can share a crib for the first few months, but by 3 to 4 months, they need separate sleep spaces. Double stroller. This is non-negotiable. A good double stroller is expensive, but essential. Time management. Everything takes longer with twins. Leaving the house is a 30-minute operation minimum. Doctor appointments are complicated. Do you bring both babies? Leave one with someone? You can't just run to the store quickly. There's no quickly with twins. Work considerations. Maternity leave might not be long enough. Some women need extended leave because twin babies often come early and might need NICU time. Returning to work with twins is harder logistically and emotionally. These are hard conversations to have with employers, but necessary. Okay, I've been pretty real about the challenges, but there are beautiful parts too. I promise, built-in best friend. Your babies will have each other from day one. Watching them interact as they get older, reaching for each other, comforting each other, it's magical. Twin bond is real and special. You do the newborn stage once. Instead of having babies 2 or 3 years apart and doing the newborn stage multiple times, you do it once. Yes, it's intense. But then it's done. Both your kids are the same age, hit milestones together, go to school together. You become incredibly efficient. Twin parents are the most efficient people I know. You learn to do everything one-handed. You learn to prioritize ruthlessly. You learn to ask for help. These are life skills. The community. Twin parents form a special club. You'll connect with other twin parents in a way that's different from regular parenting friendships. They get it, they've lived it, double the love. Yes, it's double the work. But it's also double the smiles, double the giggles, double the snuggles. 2 babies reaching for you. 2 babies saying mama for the first time. It's overwhelming, but it's also incredible. If you're pregnant with twins, here's what I want you to know. Accept that it's different. Don't compare yourself to singleton moms. Your pregnancy is harder. Your postpartum is harder. That's not in your head. That's biology. Give yourself grace. Get good medical care. See a high-risk OB or maternal fetal medicine specialist if possible. Twin pregnancies need expert monitoring. Don't skip appointments. Don't ignore symptoms. Build your village now. Line up help before the babies come. Partners paternity leave, family visiting, meal trains, postpartum doula, cleaning service, whatever you can arrange. You will need it. Lower your expectations. You're not going to have a perfect house, perfect routine, perfect anything. You're going to survive. That's the goal. Trust your instincts. If something feels wrong, call your doctor. With twins, there's less room for error. Better to be cautious. It gets easier. The first year is survival mode, but around 12 to 18 months, it gets so much better. They start entertaining each other, they sleep better, you find a rhythm. It's hard at first, but you will get through it. Twin pregnancy is different. It's harder in a lot of ways, but millions of women have done this before you, and you can too. You're growing two humans. That's incredible. Give yourself credit. Ask for help. Take it one day at a time. Are you pregnant with twins, or do you have twins already? Tell me in the comments, what do you wish someone had told you? Let's help each other out. Next video, I'm talking about starting solid foods, baby-led weaning versus purees, and what actually works. Because feeding babies is another adventure entirely. See you there, twin mama. You've got this.